Mental health and diseases. Mental health, definition according to WHO. The World Health Organization, WHO, defines mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. This definition emphasizes that mental health is more than just the absence of mental illness. It involves emotional, psychological, and social well-being. A mentally healthy person maintains balance in their thoughts, emotions, and behavior, and functions effectively in daily life. Normal behavior. Normal behavior refers to actions, thoughts, and emotions that are consistent with the expectations of an individual's society and culture. It helps a person function effectively in daily life. It is characterized by adaptability, social conformity, and the capacity to deal with life's challenges. Aspects of normal behavior include adaptability, the ability to adjust to changes and cope with stress. Balanced emotional response, appropriate emotional reactions to situations. Rational thinking, the ability to think logically and make reasoned decisions. Effective functioning, performing everyday tasks like working, studying, and maintaining relationships. Social conformity, behavior aligned with cultural and social norms. Reality orientation, awareness and understanding of the environment and one's situation. Abnormal behavior. Abnormal behavior is behavior that deviates significantly from what is considered typical or acceptable in a particular culture or society. It often causes distress to the individual or others, and may interfere with normal functioning. Aspects of abnormal behavior include maladaptiveness, inability to cope with daily life, behavior that harms self or others. Emotional distress, persistent feelings of anxiety, depression, or anger. Cognitive distortion, irrational thoughts, delusions, or hallucinations. Deviation from norms, acting in ways that are culturally or socially unacceptable. Loss of control, inability to regulate emotions or behavior. Disruption in functioning, impaired ability to work, study, or maintain relationships. Approaches to explain abnormality. There are various psychological and biological approaches used to understand the causes and nature of abnormal behavior. Each approach emphasizes different aspects. 1. Biological approach. The biological approach explains abnormal behavior as a result of physiological or genetic factors. It suggests that disorders may arise from brain structure abnormalities, chemical imbalances in neurotransmitters, genetic inheritance, or hormonal dysfunction. For example, depression is linked to low levels of serotonin, while schizophrenia may be associated with dopamine imbalance or brain abnormalities. 2. Psychodynamic approach. Founded by Sigmund Freud, the psychodynamic approach attributes abnormal behavior to unconscious conflicts, often rooted in early childhood experiences. These unresolved conflicts create anxiety, which individuals try to manage using defense mechanisms. If these conflicts remain unresolved, they can manifest as psychological disorders such as neuroses or personality disturbances. 3. Behavioral approach. The behavioral approach views abnormal behavior as learned through interactions with the environment. According to this view, behaviors are acquired and maintained through conditioning, classical or operant. For instance, a person may develop a phobia after a traumatic experience, classical conditioning, or maintain avoidance behavior through negative reinforcement. Treatment involves relearning adaptive behaviors through techniques like exposure or reinforcement. 4. Cognitive approach. The cognitive approach focuses on the role of distorted or irrational thinking in the development of abnormal behavior. It holds that individuals may develop mental health issues because of negative thought patterns, faulty beliefs, or biased information processing. For example, someone with depression might consistently interpret events in a pessimistic way. Cognitive therapies aim to restructure these maladaptive thoughts. 5. Humanistic approach. The humanistic approach emphasizes personal growth, self-actualization, and free will. Abnormal behavior is viewed as a result of blocked personal growth or an incongruence between one's self-image and real-life experiences. According to this view, a person might behave abnormally if their basic psychological needs, such as love, self-esteem, or acceptance, are unmet. Therapy in this model focuses on empathy, unconditional positive regard, and helping the individual reach their full potential. 6. Sociocultural approach. The sociocultural approach considers the impact of societal and cultural factors on mental health. Factors such as poverty, discrimination, family conflict, peer pressure, and cultural expectations can contribute to psychological distress. This approach also recognizes that what is considered abnormal can vary across different cultures. For example, certain behaviors accepted in one culture may be seen as problematic in another. Brain mental diseases, definition and types. Small blue diamond definition of mental diseases. Mental diseases, also referred to as mental disorders or psychiatric disorders, are clinically significant conditions that affect a person's thinking, emotional regulation, behavior, or social functioning. These disorders cause distress or impairment in personal, social, occupational, or other important areas of functioning. The DSM-5, Diagnostic and Statistical Manual of Mental Disorders, and ICD-11, International Classification of Diseases, provide standard classifications for diagnosing mental disorders. Small blue diamond types of mental diseases. 1. Anxiety disorders. These are characterized by excessive fear, worry, and related behavioral disturbances. Common types include generalized anxiety disorder, GAD, chronic worry about various aspects of life. Panic disorder, sudden episodes of intense fear, panic attacks. Phobias, intense, irrational fear of specific objects or situations, e.g., social phobia, agoraphobia. 2. Mood disorders. These involve disturbances in a person's emotional state, ranging from extreme sadness to excessive elation. Major depressive disorder, persistent sadness, loss of interest, fatigue. Bipolar disorder, alternating periods of depression and mania, high energy, impulsivity. 3. Psychotic disorders. These disorders involve distorted thinking and perception, including hallucinations and delusions. Common symptoms include hallucinations, false sensory perceptions. Delusions, false beliefs. Disorganized thinking. Schizophrenia is the most prominent psychotic disorder. 4. Impulse control and addiction disorders. People with these disorders cannot resist urges or impulses that may harm themselves or others. Impulse control disorders, e.g., kleptomania, stealing, pyromania, fire setting. Addiction disorders involve dependence on substances, e.g., alcohol, drugs, or behaviors, e.g., gambling. 5. Personality disorders. These are enduring patterns of inner experience and behavior that deviate from cultural expectations and cause distress or dysfunction. Types include borderline personality disorder, instability in mood, self-image, and relationships. Antisocial personality disorder, disregard for others' rights, often criminal behavior. Narcissistic personality disorder, grandiosity, need for admiration, lack of empathy. 6. Obsessive-compulsive disorder, OCD. A condition marked by obsessions, repetitive, intrusive thoughts or urges, e.g., fear of contamination. Compulsions, repetitive behaviors or mental acts performed to reduce anxiety, e.g., excessive handwashing. 7. Stress response syndromes, adjustment disorders. These occur in response to identifiable stressors, e.g., job loss, divorce. The person shows emotional or behavioral symptoms that are excessive compared to the severity of the stressor. It usually develops within 3 months of the stressor and may resolve over time. 8. Dissociative disorders. These involve a disruption in consciousness, identity, memory, or perception. Types include dissociative amnesia, inability to recall important personal information. Dissociative identity disorder, DID, presence of 2 or more distinct identities. Depersonalization/derealization disorder, feeling detached from self or surroundings. 9. Schizophrenia. A severe psychotic disorder involving positive symptoms, hallucinations, delusions, disorganized speech. Negative symptoms, lack of emotion, reduced speech, social withdrawal. Cognitive impairments, trouble with memory, attention, or executive function. Onset usually occurs in late adolescence or early adulthood. 10. Somatic symptom disorder. In this disorder, individuals experience significant physical symptoms, e.g., pain, fatigue, that cannot be fully explained by a medical condition. The symptoms cause significant distress or disruption in daily life, often associated with excessive thoughts, feelings, or behaviors related to the symptoms. 11. Post-traumatic stress disorder, PTSD. Develops after exposure to a traumatic event, e.g., war, accident, assault. Symptoms include re-experiencing the trauma, flashbacks, nightmares. Avoidance of reminders of the trauma. Negative changes in mood and cognition. Hyperarousal, e.g., irritability, sleep problems.
Thank you so much for watching. Don't forget to like, share and subscribe. See you in next video.